We have our medical expert, Dr. Ryan Light, on the phone right now to get some insight on this breaking news.
So, Dr. Light, thanks for tuning in with us tonight and giving us some insight on what the president might be going through. Now, we've been told that the president is slightly overweight. How much of that is a factor in how well he's going to do with COVID-19?
Well, the biggest risk factors are age. So at 74, he is in that age range where we see the mortality rates going up. But the weight does play a part. I think he's in the obese range in around the 30% mark based on his height and weight. I think he weighs around 244 and he's 6'3". So those are the biggest risk factors because of obesity does. As far as hypertension and diabetes, we don't know that he has any of those, but based on his age and his weight, those are significant risk factors.
Now, we're told there was a letter from his doctor that said that he is taking a single dose of an antibody cocktail and other drugs, including zinc, vitamin D, a generic version of Pepsid. What does that tell you?
Well, they're taking all the precautions. So they're using everything that we've developed throughout this whole coronavirus pandemic. So what's happening is they're using that in order to prevent him from and decrease the risk of contracting or getting worse symptoms, and trying just to prevent him from
Dr. Light, are you still with us? Dr. Light.
Yes.
Right? Oh, you're still with us?
Yeah. Yeah.
Okay, we missed the last part of what you said, so if you don't mind repeating that last 10 seconds or so.
Well, what's happening is they're using everything that we know that helps decrease how bad or how severe the symptoms can get. So this new medication that they have in phase 3 clinical trials is made to lower the viral load of the illness, so it decreases how severe the symptoms can get. So it helps save lives, and this is in phase 3 clinical trials, and it has good data that says that probably will be one of those things that helps save lives later on in this disease process.
Now, what are you expecting as far as while he's in the hospital, beyond the cocktail that they're giving him as far as the medications? What do you expect them to be doing? Will they be doing breathing treatments, would you think?
Well, yeah, I think this is, from my personal opinion, I think this is more precautionary. He's the president of the United States. He does have those risk factors of his age and his weight that are his big risk factors. And what we know about this disease is it can strike quickly. Somebody can be doing just fine, and then, they become critically ill really quickly. What they're going to do is they're going to monitor his immune system and see if it becomes hyper-responsive. That's one of the things that makes this disease so deadly, is your immune system actually takes over and actually becomes the worst enemy because it floods your lungs with lots of fluid, and that's where these people had to be put on ventilators. So what we now know is that we can test for that early on, and then we know which patients to treat in these protocols that we've developed over this pandemic so that we can prevent them from ever having to be on the ventilator and decrease that risk of death from COVID. And that's why the numbers have gotten better with the decreasing death rate with it, is because we've developed better therapeutics. We developed better techniques of how to treat this disease before it gets really severe. And I think this is just more precautionary to make sure that we monitor him very closely because he is the president of the free world. So,
Dr. Light, thank you for your perspective. We thank you for your expertise on this. Dr. Ryan Light, our News 3 medical expert.